Hi, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the board-approved instructors teaching oncology, massage, and bodywork here at the school. Wendy Langen is a physician's assistant teaching in the physician's assistant program at Barry University here in Florida. She's also been a licensed massage therapist like me for over 30 years. And the two of us collectively teach this oncology program. In our oncology home study class, we decided to do a vocabulary lesson to ensure that all of our students can follow along with the training, that we are all using the same words similarly and they mean the same thing to us. So we put together this language lesson in oncology and cancer studies to get everybody on the same page when training in oncology at our school. Now, working in the field of oncology, it's really important that you can communicate effectively with your coworkers and your clients. And that means you will need to learn some terms that might not be in your everyday use. We're going to share some of those terms with you in this language lesson right now. And keep in mind, a lot of these terms, you're already going to know them. But it's really important that when we are studying a new topic, and many of the students who are taking the oncology training with us are new to the field of oncology, that we're all speaking the same language so that we can get the very best out of our practice. I'm going to turn this language lesson over to Wendy Langen right now. She's going to go through several vocabulary words with you to help you learn a little bit more about cancer and the terms that are used in oncology operations. Now, this is not a full and exhaustive list of oncology terms. They're just some of the more common terms that are used. And keep in mind, this is only part one of a two-part lesson in our oncology training. If you want to learn more, please sign up for training with us. It is available at ceinstitute.com. And without further ado, here's Wendy.
Cancer is a word used to describe more than 100 diseases in which cells grow out of control. Most types of cancer cells form a lump or mass called a tumor. So a cell goes haywire and proliferates or grows into a tumor or a mass of cells. In oncology, there are benign tumors. Those benign tumors do not grow or spread the way malignant tumors do. They don't pose a threat to life. So benign tumors do form masses, but they don't grow out of control or spread to other areas. So they can still threaten life by becoming bigger and bigger and kind of crowding out other normal cells. But in general, they stay where they are. A cell is the basic unit of life. Cells are one unit. They do replace themselves by mitosis, and it's a process in which the cell splits in two, and then those two grow, and then they split some more. The processes that control the formation of new cells and the death of old cells are disrupted in cancer. And cancer cells in general replicate, or they undergo mitosis at a faster rate, and then they form a tumor. The nucleus of a cell is the part inside the cell where DNA is found. The DNA is the genetic material of the cell. It's the information that allows the cell to reproduce itself. Studying the size and shape of a cell's nucleus under a microscope can help pathologists tell cancer cells from non-cancer cells. One of the things that pathologists look at is the size of the nucleus when they're looking at cells. A cancer cell is a cell that divides and reproduces abnormally. It can spread throughout the body, it can also form a tumor, and it can crowd out normal cells and tissues. Cancer cells develop because of damage to the DNA, the deoxyribonucleic acid. That's the genetic material inside of cells. If that goes haywire, then the cells can divide out of control. Oncology is the branch of medicine that studies the diagnosis and treatment of cancer. We are all oncology body workers. Um, Something that is precancerous is considered premalignant. It's a cell that has undergone some change and it could become cancerous. So it refers to something that is currently not cancer but can become cancer. We see that with the infection of human papillomavirus, it causes precancerous cells to go up, and therefore some of those precancerous cells can become cancerous cells, and that's why people with HPV are more likely to develop certain kinds of cancers. A mutation is a change in the deoxyribonucleic acid of the cell. So most mutations don't cause cancer, and sometimes they're helpful. So all types of cancer are thought to be due to mutations to a cell's DNA. Those cancer-related mutations are passed. That means it goes from one cell to the next cell in that body cells. So most mutations happen after the person is born. They're called somatic or acquired mutations. So this happens in one cell at a time. It affects one cell. It's one cell that becomes many cells that become a tumor. Proto-oncogenes are genes that normally control how often a cell divides and the degree to which it differentiates or becomes a specialized kind of cell, like a skin cell or other cell. Oncogenes are genes that cause cells to grow out of control. It's usually from a mutation. They're formed by changes, mutations in certain normal genes, and then the cell has proto-oncogenes. Luckily, there are also tumor suppressor genes. So there are genes that help slow down cell division, repairs DNA, and tell cells when to die. So the cells sometimes themselves detect if something has gone haywire, and then their tumor suppressor genes cause them to stop or either fix the DNA or stop replicating, stop making more and more cells out of control. And sometimes the tumor suppressor genes can tell those cancerous cells to die. That's called apoptosis or programmed cell death. When the tumor suppressor genes don't work properly, then we have a mass of cells that grow out of control, and that does lead to cancer. Malignant means having cancer in it. Cancer is dangerous or likely to cause death if untreated. So malignant is bad. In situ means in place. So it's confined to where it is. For instance, melanoma in situ means a melanoma that has not metastasized and gone everywhere else. So it's still on the skin and it can be removed and then it does not metastasize. In our vocabulary, the primary site is the site where cancer starts. The cancer is usually named for the organ where it first starts. So a cancer that starts in the breast is always called breast cancer, even if it has metastasized to other organs like the bone or the lungs. Localized cancer is also called local cancer. It's a cancer that has not spread to other parts of the body. It's still in the organ where it started. Metastasis is the spreading of the cancer. So when cancer spreads, or those little metastatic cells, certain cells from that tumor line spread to other parts of the body and grow in other parts of the body, it's called cancer metastasis. So if colon cancer spreads to the liver, it's still called colon cancer, even though there are now tumors in the liver. It's considered to be colon cancer that has spread to the liver. So colon cancer would be the primary site. The client does not have liver cancer. They have colon cancer that has spread to the liver. So we still call it colon cancer. after it is metastasized. Metastasized means the spread of cancer cells to distant part of the body. This is usually through lymph or the bloodstream. Proliferative means the rapid or excessive growth or multiplication of cells. So cancer cells tend to be proliferative. They divide and grow faster than other cells in the body. A secondary tumor is a tumor that forms as a result of the spread or metastasis of cancer from the place where it started, that we're calling the primary site. So once cancer metastasizes, it causes secondary tumors, sometimes far from where the cancer originally started, or the primary site. Invasive cancer is cancer that is spread beyond the layer of cells where it first began. So it's grown into nearby tissues. There are many kinds of invasive breast cancer. A distant cancer is a cancer that's spread far from its original location. Sometimes these are called distant metastasis. Advanced cancer is a general term. It describes cancer that's spread from where it started. It's gone to other parts of the body. When a cancer spreads to nearby areas, it's called locally advanced cancer. If it spreads to distant parts, it's called metastatic cancer. A tumor grade is a measure of how abnormal a cells are under the microscope. So there are different kinds of grading systems for different types of cancer. Grading is done by the pathologist, who can look at the tissue under the microscope. Cancers with higher grades or more abnormal looking cells tend to grow and spread more quickly, so they have a worse prognosis. So higher grades of cancer are more likely to metastasize and cause problems. A recurrence is when the cancer comes back. It could be local or regional in nearby lymph nodes. It could also be a recurrence in an area distant to the original cancer. So cancer, if it's found in an opposite area, it's usually referred to as a new cancer. It requires its own treatment. A relapse is a reappearance of cancer or other disease after a disease-free period. Occult means hidden or concealed. One kind of cancer screening is to look for occult or hidden blood in the stool or poop. There are special tests to see if there is hidden blood in the stool, and that could indicate a kind of colon cancer. Refractory means no longer responsive to a certain treatment. So if a patient has had a certain kind of chemotherapy and then their cancer becomes refractory to it, that means that their chemotherapy isn't going to work for that cancer anymore. Regression is a decrease in the size of a tumor or the extent of cancer. So cancers can regress or get smaller. A remission is when the signs and symptoms of cancer are almost all gone. Remission is not a cure. It means that the cancer is no longer affecting the person. Palpation is using the hands to examine. Sometimes you can palpate a mass. We are seen as palpation experts, but we don't palpate over lumps and tumors. First of all, we don't press on lumps and tumors. Second of all, we do not diagnose by palpating. That is not within our scope of practice to diagnose. So we're palpating in order to alleviate pain and help improve quality of life. But we do not palpate for the purpose of diagnosis. A lipoma is a benign tumor of fatty tissue. You've probably seen this as in your course as a massage therapist. These are benign tumors, or they're unlikely to cause problems. They're a tumor of fatty tissue, and sometimes we feel them in the subcutaneous tissue. A nodule is a small solid lump. It can be felt or seen on an imaging test. A tumor is an abnormal lump or mass or tissue. Tumors can be non-cancerous or cancerous. They are abnormal lumps of tissue. Skin ulcers are open wounds on the skin. Sometimes cancers can cause ulcers. So these are also called skin lesions. So some cancers can cause ulcers. So not all ulcers are cancerous, but some of them can be caused by cancer. A lesion is an area of abnormal body tissue. It can describe a lump, a mass, or a tumor. It can also be a spot that changes, can be an ulcer. We are not supposed to massage over abnormal tissue. Necrosis is the death of one or more cells in the body. So necrotic refers to tissue that has died. A lump is a kind of mass on the body, usually close to the surface, where it can be seen. A polyp is a growth on a mucous membrane or an inner lining of an organ like the colon, the rectum, uterus, or the nose. Polyps can be non-cancerous, benign, or they can be cancerous. And routinely, GI specialists remove polyps from the colon because they can be considered precancerous. A diagnosis is identifying a disease by its signs and symptoms. Can use imaging, tests, labs, or biopsy. Most types of cancer is diagnosed by biopsy, and that's the best way to make the diagnosis or a definitive diagnosis. A pathologist can look at the cells under a microscope and determine what kind of cancer something is through a biopsy. Other imaging helps us to locate a mass. A prognosis is the prediction of the course of the disease, or it's the estimated outlook for survival. So some cancer patients may have a prognosis of a period of time in which they are expected to live. Progression is the spread or growth of a disease, with or without treatment. Some cancers will progress with or without treatment. And a protocol is a formal outline or plan, like a description of what treatments a patient will get, exactly when each should be given. So a protocol is sort of a plan of treatment.
We hope you enjoyed learning all those words and the meanings that go with oncology practice. And when you're working in an oncology clinic, you may use some of them, and hopefully they're the same meanings as what your coworkers have for their knowledge as well. This is, again, only a portion of the training that we have in our oncology studies here at the school, but we decided to share it with you for free here on YouTube to give you a taste of some of the things. This is one of the easier things that we felt we could share on YouTube publicly so that you could see what we're teaching. And if you're interested, perhaps sign up for more here at the school. So again, our website is ceinstitute.com. That's CE as in continuing education, institute.com. We have many different deliveries of oncology studies, including in-person training in real classrooms. There's live webinar training with a real-time instructor that you can ask questions and answers of in real time during your live webinar. And we have pre-recorded home study, which includes video instruction like what you just saw with part of our vocabulary lesson. This is just part one. There's a two-part vocabulary lesson in some of our oncology home study classes. So we hope you enjoyed, and until we see you in another training, be safe.